There have been instances where I've gone into a patient room in the hospital only to be asked, where's the real doctor?
I've experienced that many times. Where's the real doctor? I've even had someone refuse my care, and I'd rather not.
Racism and discrimination, a nasty disease even Black doctors in white coats can't cure.
What you see coming through the door is the color of our skin, not our bank account, not our degrees.
Dr. Carla and Rob Robinson, both inner-city Chicagoans turned charlatans, have more than 15 years of medical experience contributing to the small group of Black practicing physicians in the country. Black doctors make up less than 6% of practicing doctors in America. That's compared to white doctors who make up 56%.
It's heartbreaking because, as you mentioned, we recognize that Black patients tend to do better when treated by someone who looks like them.
Experts like Professor Deirdre Cooper Owens, who's written about how race and gender impacted American gynecology, say the struggles these women face throughout their pregnancies and childbirth all come down to racism.
You see that class and status tend to matter. The higher up you go, right, the kind of better protected you are. That doesn't exist for Black women because we're all experiencing racism in the same way. So when I walk into the office, nobody knows if I'm married or have a PhD or what my income is. The assumption is I might be lying, maybe I'm promiscuous, maybe I don't eat well. I should still be given fair treatment and equitable treatment by my doctor.
My first pregnancy, my birthing experience was pretty traumatic. And he actually punctured my spinal cord. I was temporarily paralyzed.
We were so excited about bringing Jason to this world, and then the last 2 or 3 days of his birthing process was too tragic.
I was bullied and I was abused emotionally and physically, in the sense that consent was not asked for as often as it should have been.
So many Black families with similar stories, and these experiences add to a mistrust between the Black community and the medical community, a relationship with a long, dark history dating back centuries.
Enslaved Black women were experimented on, particularly during the 19th century, so a little bit in the 18th century, but largely in the 19th century as obstetrics and gynecology became more formal and accepted branches of medicine. Marion Sims, known as the father of American gynecology, pioneers the surgery to correct this obstetrical fistula condition. People didn't know that he experimented on enslaved women. They didn't know that 2.5 years into his experimental trial, when his white medical assistants quit, he trained these enslaved women to serve as nurses. They were still his patients. They were still his slaves that he either owned or leased, and they still served as surgical assistants. So that part of the story was left out.
The success of James Marion without anesthesia. Now, doctors like Jennifer Lincoln, also an OBGYN, are fighting against present-day health disparities.
To this day, Black people are less likely to get the same treatment in terms of pain medication. They're more likely to wait longer in the emergency room. They're less likely to be taken seriously. It's a holdover from the days of slavery. And in my field, this plays a huge role in the Black maternal and morbidity crisis. The call to action. Doctors, nurses, anybody in the medical field, check your implicit bias.
Are able to get things.
A retired OBGYN, she says more support for birthing moms is needed.
So when someone first comes to you and they are just starting to learn about their options, and they're like, what is a doula? Yeah. How do you explain it?
I always like to describe it as like a birth planner for your birth. We sit with you and we really help you to see what the vision is for your birth, help you find your power. Through education, through giving you emotional support, and then helping you with resources, connecting you.
A 2013 study found that, quote, socially disadvantaged mothers who use doulas were 2 times less likely to experience a birth complication. Ebene often partners with licensed midwives like Kenesha Jones and Therese Fruget, who are medically trained to deliver babies.
Midwifery care is not just about caring for her body. We're caring for the whole woman. So we want to know what your mental state is. We want to know what your emotions are like. In our practice, they actually have lots of choices. We do their birth either here at the birth center or in their home. Some women come into our care and they're like, well, I really want to birth in the hospital, but I want midwifery care. And so we collaborate with an in-hospital provider and they get to have their hospital birth.
A 2018 study found that U.S. states with more robust midwifery services reported better maternal care and better birthing outcomes, suggesting that states that have better resources dedicated to health care have better results.